Do you know what hypertension is and how it can affect your health? Hypertension, often known as high blood pressure, is a common health concern worldwide. Yet, despite its prevalence, many people remain unaware of its potential risks and consequences. Over the next 10 minutes, we'll be taking a closer look at this silent killer. We'll explore what hypertension really is, how it impacts our bodies, and why it's essential for us to manage and prevent it effectively. This isn't just about facts and figures. This is about empowering each and every one of us with the knowledge to take control of our health, to make informed decisions, and to live healthier, happier lives. And remember, knowledge is power, but only when it's put into action. So, whether you're keen on maintaining your health or you're navigating a hypertension diagnosis, this video is for you. Stay tuned as we delve deeper into understanding hypertension. What exactly is hypertension? Hypertension, often referred to as high blood pressure, is a long-term health condition where the pressure of blood against the walls of your arteries is consistently too high. Picture this. If your arteries were a garden hose, hypertension would be like turning up the water source to full blast. Over time, this excessive pressure can damage your arteries and lead to serious health complications. Now, there are two main types of hypertension, primary and secondary. Primary or essential hypertension develops over time with no identifiable cause. It's the most common type, affecting about 95% of hypertension patients. A mixture of factors, including age, genetics, and lifestyle choices such as diet and physical activity, can contribute to its development. On the other hand, secondary hypertension occurs as a result of an underlying health condition. It tends to appear suddenly and cause higher blood pressure than primary hypertension. Conditions such as kidney disease, hormonal disorders, or even certain medications can be the culprits behind secondary hypertension. So why is blood pressure so important? Well, blood pressure is the force that moves blood around your body, delivering oxygen and nutrients to your tissues and organs. It's a bit like the postal service of your body. Without it, your body wouldn't get the essential supplies it needs to function correctly. However, when this pressure is too high, it can strain your heart and damage your arteries, making them less efficient at their job. In a nutshell, hypertension is a silent, yet potentially harmful condition. It's silent because it often doesn't show any clear symptoms until significant damage has occurred. And it's harmful because, if left unchecked, it can lead to severe complications such as heart disease and stroke. Now that we know what hypertension is, let's explore how it can affect your health. How does hypertension affect your health? You may have found yourself asking this question, and today we're going to delve into the answer. Hypertension, or high blood pressure, is often referred to as a silent killer. This nickname comes from its ability to cause significant damage to your body without you even realizing it. One of the major health risks associated with hypertension is heart disease. When you have high blood pressure, your heart is forced to work harder than usual. This extra strain can cause your heart to enlarge and thicken, which can lead to heart failure if left untreated. It doesn't stop there. Hypertension is also a leading cause of stroke. High blood pressure can cause damage to the blood vessels in the brain, leading to a stroke. Imagine a pipe under too much pressure. It can burst, right? That's essentially what happens during a stroke, and the consequences can be severe, leading to both physical and cognitive impairments. Kidney disease is another potential complication of hypertension. The kidneys, our body's natural filtration system, rely on a network of tiny blood vessels to do their job. High blood pressure can damage these vessels, making the kidneys less effective at filtering out waste and toxins from our bodies. Over time, this damage can lead to kidney failure. And let's not forget about the eyes. Hypertension can lead to hypertensive retinopathy, a condition that can cause blurred vision or even loss of sight. But here's the thing, these health risks are not inevitable. Regular blood pressure checks can help you stay on top of your health and catch hypertension early. By keeping an eye on your blood pressure, you can take steps to lower it if it's high, reducing your risk of these serious health problems. Knowing the risks, it's crucial to manage and prevent hypertension. But how? Well, stay tuned as we delve into that in the next scenes. The power to manage and prevent hypertension is in your hands, and we're here to guide you every step of the way. How can you manage hypertension effectively, you might ask? Well, it's like managing a well-oiled machine. It requires consistent care and attention. And the good news is, there are numerous practical steps you can take to keep your blood pressure in check. Firstly, regular physical activity is essential. It's like fuel for your machine. Aim for at least 30 minutes of moderate exercise most days of the week. This could be anything from a brisk walk to a quick swim or even a dance class. Physical activity helps to lower blood pressure and keep weight under control. Speaking of weight, maintaining a healthy one plays a significant role in managing hypertension. Excess weight can increase your heart's workload, causing your blood pressure to rise. So it's crucial to keep those extra pounds at bay. Next, let's talk about diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help lower blood pressure. On the flip side, foods high in sodium, such as processed and fast foods, can cause your blood pressure to skyrocket. So it's a good idea to limit your intake of these. Moreover, moderation is key when it comes to alcohol. While a glass of red wine may have heart benefits, excessive drinking can lead to a spike in blood pressure levels. Stick to moderate drinking guidelines. Up to 1 drink a day for women and up to 2 drinks a day for men. Lastly, never underestimate the power of medication and regular checkups. If you've been prescribed medication for hypertension, stick to the regimen. Regular checkups with your healthcare provider are also vital to monitor your blood pressure and adjust your treatment plan as necessary. To wrap it up, managing hypertension is not just about taking medication. It's about adopting a holistic approach that includes regular exercise, a balanced diet, moderation in alcohol consumption, and maintaining a healthy weight. Remember, your health is in your hands, but don't forget, managing hypertension is one thing, preventing it is another. What steps can you take to prevent hypertension? Now that we've delved into understanding and managing hypertension, it's time to focus on prevention. As the old adage goes, an ounce of prevention is worth a pound of cure. And this is especially true when it comes to hypertension. Preventing hypertension primarily revolves around maintaining a healthy lifestyle. Let's break it down into 4 key strategies: regular physical activity, a balanced diet, stress management, and regular checkups. First, let's talk about physical activity. Regular exercise helps maintain a healthy heart and blood vessels, which is crucial for preventing hypertension. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be anything from brisk walking to cycling or even dancing. Remember, the goal is to keep moving. Next, we have a balanced diet. Consuming a diet rich in fruits, vegetables, whole grains, and lean proteins can significantly lower your risk of hypertension. Try to limit your intake of processed foods, saturated fats, and sodium. And don't forget to drink plenty of water. Thirdly, stress management. Chronic stress can contribute to hypertension, so it's essential to find healthy ways to handle stress. This could be through meditation, yoga, spending time in nature, or even just taking a few deep breaths when you feel overwhelmed. Find what works for you and make it a regular part of your routine. Finally, regular checkups. Regularly monitoring your blood pressure can help catch any potential issues early. It's recommended to get your blood pressure checked at least once every 2 years, and more often if you have a family history of hypertension. These strategies aren't just about preventing hypertension, they're about promoting overall health. By adopting these healthy habits, you're not only reducing your risk of hypertension but also improving your quality of life. So let's take charge of our health. Let's make time for exercise, eat a balanced diet, manage our stress, and remember to go for regular checkups. Prevention is always better than cure, especially when it comes to hypertension. So, what have we learned about hypertension? We've embarked on a journey to understand this silent yet potent health issue. We've discovered that hypertension, also known as high blood pressure, is a condition that affects millions worldwide and can lead to serious health complications if left unchecked. We've delved into the impact of hypertension, noting that it can be a silent killer, leading to heart disease, stroke, and even kidney failure. But we've also learned it's manageable. Through regular monitoring, medication if necessary, and lifestyle changes like a balanced diet and regular exercise, we can keep hypertension at bay. We've also explored prevention strategies. Adopting healthy habits early on, reducing salt intake, maintaining a healthy weight, and regular checkups are key to prevention. Remember, knowledge is power. It's in your hands to take control of your health. Stay informed, stay healthy, and keep your blood pressure in check.
Please like, share, subscribe and comment. Thank you for watching FS Vlogs.